I think we don't really talk about this in medicine because it's a little bit woo-woo, I think. But the idea of connection to the spiritual self is so important. And I always say to patients, like, I don't care what it is or how you connect to something greater than yourself. It's just the idea that you do connect, because studies show that people who have a belief in a higher power or something greater than themselves, they do better. Like, the outcomes are better. They live longer and they feel better. And so the research is really there to back up this spiritual connection. But you're right, like, how do you really talk about that in the course of a visit? And so it's easy to come back to the science and talk about the idea of regulation of the nervous system, and that we really want to encourage more parasympathetic tone. So more rest and digest, less fight, flight, or freeze.
You are listening to the Pinnacle Podcast, where we empower women in medicine through education, community, and actionable strategies for both the practice and the business of medicine.
Medicine is a lifelong career, and continuing education is crucial for professional development. Pinnacle is the first and only multi-specialty organization dedicated to addressing the challenges that all women in healthcare face.
Welcome to Pinnacle, the elite professional community providing education for women in medicine. At Pinnacle, we challenge you to pave your own path by helping you develop the skills needed to not only stay in medicine, but to excel.
Welcome to the Pinnacle Prescription Podcast. I'm your host, Dr. Natalie Crawford, and today I am joined by Dr. Katie Takayasu for Integrative Medicine, approaching patient care with a whole body approach. Katie, thank you so much for being here with us today.
It's my pleasure. I really, really appreciate the invitation to be on and to join you to celebrate really the whole body and the whole person, for sure.
I love it. Well, I'm going to take a second and just brag on you a little bit. So you are author of Plants First, a physician's guide to wellness through a plant-forward diet. And I know you're a speaker and your passion is really promotion of holistic health. You bridge the gap between traditional medicine and that evidence-based but complementary approach with nutrition, acupuncture, meditation, and lifestyle optimization. You got your undergrad from University of Michigan and then your medical degree and an MBA from Wright State University, and did family medicine residency at Columbia and New York Presby, where you served as chief resident. And you're currently an assistant professor of clinical medicine at Columbia. And I know people can find you all over drkatie.com. And I'm so excited to have you here today.
Thank you so much.
All right. Well, I kind of want to start by just giving somebody who maybe is first listening to this an idea of how you got into this space. Coming from family medicine and traditional medical training, I'm going to take it this was not necessarily how you were trained. It wasn't how I was trained in medical school.
Totally. I think the transition to integrative medicine came from a very personal space. I started in sort of getting really into it when I was a resident, and it became a part of my own journey to becoming a mom. I noticed during residency that my period was super irregular, and I just was really feeling at that time like a shell of myself. And so I pulled it all together, went to go see my primary care doctor, and he recommended that I see his wife's acupuncturist, who had been successful in helping her get pregnant. And I, just sort of went there with an open heart and never felt so amazing as I did on the acupuncture table. And I literally came home and told my husband all about it, my friends, and just really went full step into figuring out more about the science behind acupuncture. And at the same time, stopped eating the hospital food. I started exercising when I wasn't on call and really trying to get as much sleep as I possibly could. And at the same time, really found a yoga teacher that really spoke to my spiritual space. And so in no time flat, had built all the personal principles and pillars of integrative medicine into my own life. So when I was thinking about what I wanted to do for the rest of my life, it made a lot of sense that I would do a fellowship in integrative medicine. And honestly, I've never been happier. I can't believe that I didn't even know this field existed when I started medical school, and I'm so glad that I found it.
So you were more on the forefront, though, of finding this field, right? Because I feel like, the whole body approach and lifestyle medicine or integrative medicine feels a little bit trendy or newer, but you've been in the space for quite a while.
That's true. I mean, I've been practicing this in my own life since 2010, and I started my fellowship in 2012. So I was, full-fledged practicing this since 2012, all the way through fellowship, and then starting, as an attending in 2014. So I've been doing this for a long time, greater than 10 years now.
I love it. Where do you think we'll go through a bunch of this. Obviously, for somebody who practices medicine listening to this, there's two sides. You're going to think about your own health, which is how you even came to find this, but then also how you treat people and potentially what else there is that you can think about when it comes to a whole body approach. Let's talk about personal health to start with. What is the number one first step, first thing? Where do you think most people, what do you think they get wrong or they don't know?
Oh, in personal health? I mean, there's so many things, especially now that I'm a woman in my 40s and understanding my body in a new way that I really never understood it before. I always joke with patients that seriously, north of 40, like nothing feels the same. You can't drink the way that you drank when you were in your 20s and 30s. You can't like undersleep yourself the way that you could when you were younger. Aches and pains feel totally different in the body. And so as I think about what really resonates with patients, it's about rethinking and retooling things that has always worked or always worked for them, and retooling them for this new part of life. And really what that comes down to is a balance. You're never going to have a perfect day where you like totally nail it on the nutrition and totally nail your workout and totally nail it when it comes to meditation or whatever else you're trying to do. But it's all about the balance every day. So waxing in and waxing out. So some days you're going to have a total killer workout, and other days you're going to totally nail it when it comes to getting your protein, fiber, and your fat macros together. Other days you're going to have those times when you're like, gosh, I just had a really great sleep last night, or maybe I had a really great meditation session this morning. And so for me, it's really about the balance. And I think that we can get in these pigeonholes of like, well, I'm going to make sure that I do this particular exercise.
If it's not perfect, it's not worth it, right?
That's exactly right. Exactly. If it's not perfect, then I'm not, I'm not excelling at it. I'm not doing it. And there is this gentleness that we need to take with ourselves. At the same time, we still need to make sure we're doing what we need to be doing. And I find that women generally are under eating, over exercising, and not taking good care of themselves when it comes to their spiritual health.
Do you feel like healthcare providers themselves, especially female healthcare providers, are, worse at this? I know for myself, I can say it's taken me a long time to get to the space where I will say I have time for that, because if I don't make time for my own health, I will lose it. And then I don't have time for any of the things. But I'm very tied to that idea. And it's so hard for me. If I had a workout plan and I don't have exactly 30 minutes, then I have the whole, I just won't do anything. And I know it's actually even my son who's been very much, he'll jump on the treadmill, he has 10 minutes, or he'll do, a 15-minute yoga, and just saying, yeah, okay, I need to let go of the idea of what I thought it would be and just realize that something is better than nothing. And I'm sure you're going to tell me that, yes, as healthcare professionals, we are the worst at this, probably.
That's probably true. And I used to call that when my kids were really little, and I literally found myself with 13 minutes. I called it the 13-minute workout. And it was like whatever I could accomplish in 13 minutes before I had to jump in the shower and then race to work. And I think that we do get in our own way that way. So if you do have 13 minutes, or you are, have the opportunity to grab a salad and get a nice form of protein at lunch, we make those choices when we can, and then we don't demonize the times that we make the best choice that we have given the opportunities in front of us. But I think it comes back to this idea of like, it's good enough, and don't let good enough get in the way of feeling good about the decisions that you're making for yourself on a daily basis.
Oh, that's such good advice. If we want to step back and you want to tell me what is integrative medicine, like for somebody who is listening to this episode and maybe hasn't really heard the term, or has heard it but not really fully understood all the components of it, and what you were trained in, do you want to break it down, the different pillars of what really goes into this?
Absolutely. So integrative medicine is that beautiful mix of regular Western medicine mixed in with complementary evidence-based modalities. So in my practice, I was trained just like every other Western doctor, went to family medicine residency, have the MD, and then got special training to do integrative medicine in the form of things like acupuncture, teaching patients the value of meditation, also educating patients about nutrition and how to use that as a tool in their life. I do a little bit of functional medicine medicine as well. So sometimes I'll use fancier, as I call them, fancier lab tests to help me get a little bit more information about someone's microbiome or what's going on with their stress hormones or things of that nature. But generally, I don't use those labs a ton because most of what I get from a patient is based on the history, just like every other doctor. And I can tell what's happening with someone just based on what they're reporting. And it's nice then to have, evidence that backs things up. But there isn't evidence out there for absolutely everything. And so even though we know that someone who's going through perimenopause might be benefited by certain adaptogens like black cohosh or other female support herbs like vitex berry. Even though we have some studies to show that those kinds of things work, they're not as robust as pharmaceutical studies, mostly because there's not as much money behind them. And so we use the evidence that we have in the best way that we know how to help patients navigate multiple things and multiple stages in their lives. And what the patients love, of course, is that someone is listening to the full story. They're tired of having a parts provider. They want someone who actually is looking at their whole body and looking at it, from really the 10,000 foot view so that they know that everything is being taken care of. And what's really cool about the type of medicine that we do is that if you're working with someone and you're working on nutrition or you're doing some acupuncture, you're not just doing one thing for one problem. You're doing one thing that has multiple reaches within the body. And so the sum of the parts are way greater than each individual thing that we might be doing.
I love what you said is that our patients are sick of, or we shouldn't be like a parts provider, obviously. I mean, like,
I know.
I'm a subspecialist, like I am that, but I resonate so much. And it's probably the number one thing that my patients will complain about is this idea that, your ovaries, your uterus, your reproductive hormones are in a silo and that they're not impacted by everything else that's happening in your body. And I think that is such an important view, and even as a mindset shift to those of us who are subspecialists, because we are the experts on this one part, but the whole body is a whole, right? And so really making sure that either we are validating those, symptoms, helping give support, give other, if that's not us, like who can patients see, who can help provide that aspect of care? Because I do think that it's something that we're lacking in our more traditional medical training. If we want to break it down, let's go step by step. Okay, so what is your recommendation when it comes to sleep?
I think of all the things that I come back to 4 pillars, really. It's like, how are we sleeping ourselves? How are we feeling ourselves with nutrition? Are we moving our physical body every day? And how are we taking care of our spiritual selves? And I think when it comes to sleep is probably the thing that is the most important, because literally it makes everything better. And when we don't sleep, we just can't regulate our emotions. We can't regulate the way that we feel about things. Our appetite is all over the place. We feel fatigued. We just can't show up in our lives the way that we want to. And there's sort of 2 issues. One, when you can sleep, you just choose to undersleep yourself, meaning you go to bed too late or you wake up too early because of work or other sort of tendencies that we have. And then there's a whole other sort of issue is that if you can't sleep and you find yourself waking up frequently or you can't fall asleep easily. And so trying to figure out which camp you fall into is really helpful. But if you can sleep, just simply getting a little bit extra sleep can be really revolutionary to everything from trying to manage your weight to controlling anxiety symptoms. And if you're having trouble sleeping, of course, trying to figure out where that is coming from. For women in their 40s and 50s, so much of the sleep dysregulation is simply just because our hormones are kind of changing so much. And so once the hormones come into balance, we tend to feel a little bit better. But also addressing things like chronic pain and other stress or anxiety, depression related issues can be really useful there too. But my recommendation truly is to think back to when you were maybe 20 or 30 years old and you weren't sleep deprived and you were, maybe you're in college. What were you sleeping? Like, how much were you sleeping? And most of us will probably, sort of settle out around 8 or 9 hours. And it's pretty rare for me to meet someone who actually only needs 6 hours of sleep. Likewise, it's pretty rare to meet someone who really needs 12. So if you're probably in that 7 to 9 range, and you really need to make sure that you're getting that sleep, because if you're shortchanging on the front end, meaning you're staying up too late, you're not adequately pruning those neural connections and taking all the stuff out of your mind that you don't need to know for the rest of your life. And if you're shortchanging your sleep by waking up too early, so on the back end, then you're not taking short-term memory and putting into long-term memory. So you can see why things like memory and brain fog ensue when people just don't sleep enough.
I similarly say the same thing. Like the number one thing when my patients are asking me what can they do for their hormones or their fertility, I said, well, the easiest thing and the thing that's also the hardest is get enough sleep, because that's probably the thing that most people are lacking in. And it is like when your body repairs itself and then fuels up for that next day. As far as like sleep practices, so obviously like get enough, and we'll say that that's going to be in that 7 to 9 hour range. Do you have any tips you give people, your patients, when they say, well, I have such a hard time falling asleep, about maybe tips to set a good sleep environment, or when do they have such a problem that potentially they need, medical help or other interventions?
So there's lots of different tricks and tips that you can use to help yourself kind of wind down from the day. We have this sort of expectation that we can go, go, go all day, and then just magically at like 10 p.m., we're just going to like fall to sleep. And that only really happens if you're like completely exhausted, right? We need this wind down time at night. And if you're a parent, you know that it's a wind down for your kids actually has to happen sort of in the same rhythm every night. And as soon as you try to like cut out the book or cut out the bath or cut out whatever the thing is for your small child, like they rear their ugly heads because they want like that rhythmicity. We need that rhythmicity too. And the biggest predictor of your ability to fall asleep at night truly is if you have like the darkness cues. And so at my house, generally after like 7 p.m., like especially in the winter, it's only one light on in all of the downstairs. And that's like the one light so that we can see where we're going. But to really start that darkness cue for ourselves, that we get the natural melatonin secretion. And I might watch something on TV with my kids, but generally nothing stressful, usually very funny, because you don't want to suffer from what they call like post-traumatic sleep disorder, which is like where you watch like an episode
Law
of
and Order SVU. You're telling me not to do
exactly.
that in my bed.
I know. Don't watch SVU before bed, because you get kind of like revved up, and it's just hard to like slip into sleep when you're, even if you're not worried about the boogeyman out the window, like you can still feel kind of revved up. And so then I've also come to really like, as my kids kind of wander up to bed and they do their reading and kind of like hang out, I slip into the bath and I soak in magnesium salts for about 10 minutes every night. It really relieves so many aches and pains. I can't even tell you how many aches and pains go away.
Oh, I'm going to write that one down.
Yeah. Epsom salts, they're so cheap. You can get them at Target. I have them shipped to my house from Target by the box. And I put a whole cup in, I soak for 10 or 15 minutes. And at the same time, I do meditation, and it's nothing fancy. I'm just breathing and trying to like let go of the day. And so I'm all about like trying to find things in our life that will do more than one thing at one time. And so the bath with meditation really helps me wind down so greatly that by the time I get to bed and I read for a few minutes, I'm tuckered out and I'm ready to fall asleep. But that kind of curation takes time. Like that's my rhythm, but maybe yours is different. And I am also a morning lark, so I like to get up early. So going to bed early makes sense for me, but that maybe isn't the rhythm for everybody else.
So what I'm hearing is that adults are just, bigger versions of small children, and we need our own bedtime routine that stays consistent to really set the stage, and things like mimicking how life would be if we were not in our nice little houses with electricity all the time, as far as the darkened clues, the quieter environment. Those things are important, and we should try to prioritize them most of the night so that we can get better sleep.
Absolutely. And then the other part of that is when you wake up in the morning, trying to get morning light, within the first hour that you're awake is also really important, because that light is really important to helping to shut off the melatonin in the morning.
So you're in New York, right? And I was just there, and it's light, so nice and early in the morning. But I'm in Texas, and I'm here on the other side of the time zone, the very end of it. And I'm driving to work, it's 7 in the morning and it's still dark. So what do you recommend for somebody who's maybe not as light in the morning when they get up? Is there something to do? Does artificial light help in that scenario just by getting it on?
It sure does. So as you're maybe sipping your tea or your coffee or whatever in the morning, or whatever, I have a light box. So in the winter I get that guy out, and it's like the size of like a monitor, like for a computer, and what you're looking for is 10,000 lux. Like that's the strength of the light you want. And it's just 15 or 20 minutes that you want this to be sort of on you. You don't need to stare directly into it, but it's kind of just like in my periphery. And that sort of helps to set the circadian rhythm, so that you can, feel the best that you can in the morning. And then the other piece of it, your question too about like, well, when do you seek help? And the truth is, like, if you are struggling more, several days a week, more than 2 days a week, and it's going on for more than a month, then that's starting to really impact the way that you're functioning at work or with your family. Then that's when I would start to reach out. And that was when I transformed my own sleep. I found myself back when we renovated my house and my kids were about 3, starting preschool. My husband started volunteering for the fire department and they changed to ICD-10 at work. And I was like, oh my God, too many things happening at once, and started struggling with insomnia. And I went to see a CBTI therapist. So CBTI is cognitive behavioral therapy for insomnia. And that's the only class A evidence that's non-pharmaceutical approach to solving for insomnia. And so that approach can be also really helpful for someone. So finding a CBTI therapist could be revolutionary.
Tell me about, maybe this is merging a little bit from sleep into spirit, but let's talk about meditation for a moment, because so many people will say, well, meditation doesn't work for me, or I can't do meditation. And I'm sure you hear that and encounter that frequently. So what do you say about that? What tips do you have?
Everybody stinks at meditation. I think that's like the important thing to recognize is that even I've done this for many years now. My mind can wander 30 times in 5 minutes. And we welcome ourselves back to meditation and to the present moment, to breath work or whatever you're doing, just the way that you would treat a small child in your life who's maybe learning to walk. You wouldn't say to a small kid, like, you idiot, you fell again. You'd say, like, come on, get up. It's fine. Like, you're going to be great. Let's do this again. And so you sort of treat yourself the same way when you meditate. It's like, just come on back to your breath in the present moment. But what's so great about meditation truly is that when we let go of the rumination about the future and the anxiety that we have and worry, and we let go of the rumination of the past and the regret and sometimes the sort of sad feelings that we have, and we come back to the present moment, what we realize is actually in this very moment, we are fine. And that we can use this present moment to regulate our breath and regulate our neurochemicals and the body and the brain response together to help our body kind of feel better by regulating the parasympathetic and sympathetic nervous system. And the idea is like, it's like riding a bike. You just keep doing it over and over again, and you get a little bit better at it every single time. You never really forget how to do it. And honestly, it's like a vacation for your brain. So sometimes in the morning when I don't want to do my meditation, I'm just like, I just don't want to do this right now. I remind myself that for this next 10 minutes, like nothing is expected of me. Like my only goal is just to be right here, enjoying the present moment and giving my brain a vacation. And that actually feels like a big reward.
I was like, that sounds actually like quite refreshing,
It
right?
sounds
Versus
amazing,
like
right?
everything else we do. When it comes to meditation, like speaking on this topic, like, and maybe this is not the right answer, but just personally, I know like somebody once said just like lowest hanging fruit, like it doesn't have to be perfect. And like, I love Peloton. So I have the Peloton app and I'll put on some of their meditations. And I know other people have used like Headspace or Calm or other things. And do you have certain ones that you like more than others? Are there things you recommend when it comes to that?
The easiest meditation is the one that you'll do. And the best one is the one that you'll do.
I say that about the prenatal vitamin. The
Exactly.
best prenatal vitamin is the one that you will take.
Yeah. If it doesn't make you nauseous and you get it down the hatch, like you're winning. But if you have a Peloton already, like it's already an app on your phone, or you have the Calm app, that's fantastic. The one that I really love is called Waking Up. And that is a really cool, it's not just meditation. They have tons of different content on, everything from like time management to just finding your spirituality in nature. And they have all different types of meditation. But honestly, it doesn't even matter. Most times the meditation I do is actually just breath work. And it literally is just me lying in my bed after my snooze button has gone, or I push the snooze button on my phone. And I take that 9 minutes and I just regulate my breath.
Yeah.
And that regulation of my breath around my abdomen, I just find really soothing. And my mind, as I said, it wanders 30 times and I just welcome it back.
I was like, I'm just like really like thinking about the snooze button thing for a hot minute, because I never used to be, now this is too much of my own personal, I never used to be a snooze person. I'm a morning person, but my best friend on planet Earth, and we lived together for like 4 years, and she's such a snooze person that now I feel like it is so ingrained in me. It probably drives my husband crazy. However, you are like getting both, like you're snoozing times one, but you set that set amount of time now has a purpose that's then fueling the rest of your day. So I really am enjoying how you're saying, I'm getting up, I don't have to get up quite yet. I'm going to take this time for just me.
Absolutely. And the house is so quiet at that time. And it's so warm in your bed, and you can kind of like just kind of snuggle up in your covers. And like, it's not the typical type of meditation. They mostly recommend that you sit up, have nice posture. That helps with your attention. That just feels like a lot of effort in the morning to me. So lying in bed and doing that beautiful 9-minute meditation, it's not a big ask, and it actually feels really, really delicious. And I've actually really paid attention to the way that I show up to my family. And when I don't do it, I'm not as nice, right?
Okay, I love it. Like, hey, it's mommy's meditation time. You need to like go away. No, I don't think, especially as people who are, maybe mostly like type A and live these very busy lives and have a lot of balls in the air at one time, give enough thought to the way that we like wake up and go to bed as very important pieces to our mindset and how we function throughout the given day. I want to ask you more about spirit because I feel like we're a little bit in here and a little bit not. And that's probably what you talk about last. But before we go to movement and fuel, tell me about spirit and what's your approach there? And what do you mean by having that as one of the pillars?
I think we don't really talk about this in medicine because it's a little bit woo woo, I think. But the idea of connection to the spiritual self is so important. And I always say to patients, like, I don't care what it is or how you connect to something greater than yourself. It's just the idea that you do connect, because studies show that people who have a belief in a higher power or something greater than themselves, they do better. Like, the outcomes are better. They live longer and they feel better. And so the research is really there to back up this spiritual connection. But you're right. Like, how do you really talk about that in the course of a visit? And so it's easy to come back to the science and talk about the idea of regulation of the nervous system, and that we really want to encourage more parasympathetic tone. So more rest and digest, less fight, flight, or freeze. And the way to do that is connection through the spiritual self. And this can take the form of any kind of meditation, any kind of prayer, any kind of purposeful movement. So you can have spiritual time when you're taking a walk in nature and you're just paying attention to what's around you. You can have spiritual time when you're doing yoga or Tai Chi. You can have spiritual time, honestly, when you're just drinking your coffee and not doing anything else. But really, it is not so much about dedicating time to that thing, but actually removing obstacles in our lives that allow us not to focus. And so it's really about focus on the self and focus on the present moment that allows for that spiritual connection to the self. And so I do talk about that with all patients because it's just so important. And honestly, it makes people feel a lot better to know that their doctors think that that's important too.
I always say, and this could be wrong, but right, I'm coming at a lot of patients who especially are really trying to optimize their whole being in the fertility space, trying to get pregnant. There's such a loss of identity as you go through it. And I always think about, and I haven't ever framed it as spirit. And I think that's like a very good way to think about it, as it's important to not make yourself the center of the universe for some time every day, meaning reminding yourself that you're this one piece of a bigger puzzle, whether it's walking with the birds outside or grounding yourself or thinking about your higher power. So it's the same idea, maybe reference different, that, there's a whole big world of a whole lot of us and we're just like one little piece. And sometimes it's easy to let the problems or the stressors that we're having feel so all consuming until you take the moment and you step away from them. So I think that's such a nice and refreshing way that you're saying it, kind of with a spiritual emphasis on, your body, your mind, your spirit, right? Not just take this medicine to feel better, right? So I really love it. And just talking about it.
Oh no, I appreciate what you're saying too about like recognizing that we are just part of, we're part of a really big world, and that even though we all have problems, sometimes when we kind of zoom out and see ourselves as sort of a part of this bigger universe and the majesty, honestly, around us, especially this time of year, it's so easy because so much is coming into bloom and feeling so nice as we walk outside. There's a real invigoration of the spirit that happens. And if you don't really know what your spirit is, then it's good to actually just take a little bit of time and try to nestle into that inner space, like the real you. If you don't know who that real you is, then doing that deeper dive into figuring out, because honestly, everything else, just like sleep, everything else will go better in life if you are in touch with that part.
Tell me about movement, okay? Because I know that in when it comes to exercise as medicine, and this is always really conflicting information, I think, from a scientific purpose, because you have different outcomes, yet the intervention of exercise is so different, right? So is your outcome weight loss or improved lab parameters or feeling happier? And I'm sure your take on it is going to be a little bit different, because I know that when I look at it, there's so many different variables that are being studied and different outcomes that I have to tell patients there's not going to be one study that answers this. But that's also not the reason why you move your body. But I want to hear your approach, because I'm really loving how you phrase things and what you recommend to people when it comes to movement.
I say you have to move your physical body in some way every day. And it doesn't really even matter how, as long as it comes from a joyful place. So even if you know that weightlifting is the best thing that you could be doing, but you absolutely hate it, well, that's not going to be a great exercise for you because that's not joyful. And so finding some play in our day is actually really fun. One of the best things I ever did was start going to a personal trainer, but making my husband go with me. So it's like the new all-American date. And we go together, and honestly, we razz each other so much and we call each other by our last names. It's just so funny the entire time. Like, we're so hard on each other, but like we push each other to go, to work harder. And so I think whatever kind of an exercise that you find enjoyable is, and the one that you'll do, that's the one that is probably best for you. If you want to get super scientific-y about things, as we get older, we just need more movement, and especially we need more strength training. And so what you can kind of get away with in your 20s and 30s doing more cardio, once you get into your 30s, your 40s, 50s for sure, and beyond, you need to be spending a significant amount of time doing something that is resistance training. And so that can take the form of many different things. It could be in the gym lifting weights, it could be working with machines, it could be doing Pilates or body weight exercises or any of the plethora of apps that exist out there. But especially for postmenopausal women, the new sort of recommendations are that you do a little something every day when it comes to resistance training, instead of having these marathon 1 hour sessions that you might do once or twice or 3 times a week, because we do have increased risk for injury as we get older. And so I would love people to do, somewhere between around 7 or 10,000 steps a day. I'd love people to build in at least 1 or even 2 yoga sessions in the week, and getting into some kind of resistance training 3 or 4 days a week. Like, that would be ideal, but that's not ideal and not possible for everyone.
Okay, but that would be if you could have a Dr. Katie's prescription for movement.
Yeah, that would be the prescription.
That's what it would say. Okay. And what I did not hear, and what I want to reiterate, is that, you don't have to do all HIIT classes and it's not all cardio. I know, I feel like we know that, but people still have this idea that they're posting, their super fast runs or their HIIT workout, and that's some badge of honor, when the reality is it's not what your body needs every single day.
That's exactly right. And for women, especially who are still cycling, you don't want to be doing those kinds of big, intense workouts in the week before your period comes or when you have your period, because it's just not the best kind of workout for you at that time. Whereas when you're ovulating or in the first half of your cycle during your follicular phase, that actually can feel really good to do a stronger strength workout, but it could really poop you out, closer to the start of your period. So also being cognizant of where you are in your cycle is important to what kind of workout, that you're choosing for yourself. And I actually really think that it's important to say that you shouldn't be exercising at a 10 out of 10. If you do something and literally an hour later, you're like, someone's got to mop me up off the floor, it was way too much for you. But if you walk away from a workout and you feel happy and you feel energized, and a few hours later, your energy is still good, then that's a great workout for you. And everybody's got that tolerance of where they need to be. But generally it's a 6 to 8 out of 10 on the scale of effort.
Do you find a difference in morning workouts or evening workouts, or is that just going to be such person dependent?
I think it's person dependent, but I think if you're trying to optimize your own cortisol rhythms, your own natural circadian rhythm, we do have more cortisol in the morning. We do tend to have more energy in the morning, and so it makes sense to me to work out in the morning. I used to do a lot of fasted workouts, meaning I wouldn't eat before I worked out. And now, given all the information we know about how much the blood sugar responds positively to movement after meals, my newest strategy really has been to fuel with protein in the morning. I eat carbs and fat, of course, too, but protein forward at breakfast. And I do it before I work out. And I've noticed a really nice rhythm where actually I feel like I can lift more, I can do more, I'm happier, and I feel really fueled up for the workout as opposed to kind of like pulling from an empty place.
I think that's really good advice. I do think there's this whole, I guess let's use that to lead into topic next, which will be fueling yourself, because I do think there's been a lot of focus, especially in the more recent years, on intermittent fasting and not eating at all areas. And would love to know your thoughts on that, nutrition in general. But what I have seen is that approach, even though it could be beneficial for some people, especially for women, has really pushed a lot of people into very restrictive eating and eating many fewer calories than they actually need. But would like your take on, we'll do intermittent fasting and then kind of talk us through nutrition and your views on it.
I think intermittent fasting for some people can be really helpful. If someone has a history of insulin resistance, prediabetes, PCOS, certain types that are more metabolic in presentation, if they want to decrease their insulin response, we do know that time restricted eating does seem to help with that. But I think probably we don't do it in the right way. In order to regulate your cortisol, you probably need to be eating within 1 or 2 hours of awakening. And if you're not, and you're kind of feeling stressed, then you're just going to make yourself more stressed by skipping breakfast. And so a better intermittent fasting or time restricted eating kind of methodology might be to eat breakfast and try to eat dinner earlier, so that your window for eating maybe would be 7 a.m. to 5 p.m. instead of like say 12 p.m. to 8 p.m. So I do think that there's some benefit to time restricted eating, but I don't think that delaying breakfast is really the way to go for most women, because most of us are pretty darn stressed. I think we hate to admit it, but we're just more stressed than we think we are.
But that's what intermittent fasting has done, is that some people are just totally not eating until that like lunchtime. So they're half their awake hours, they're going without fuel.
Exactly, which doesn't really to make that much sense, from an outside perspective. And not to mention, I think it also leads to a lot of fatigue. When you don't eat regular meals, like you tend to feel a bit tired. And then people will overeat at the lunch and dinner meals. So they're not really actually eating fewer calories. They're just eating it in a shorter window. A better strategy in my mind is to start with breakfast within a couple of hours of awakening, to make sure you're getting 30 grams of protein at that very first meal of the day, so that you really fuel up in you rebuild your amino acid stores that you've burned through over the course of the over the night, and then have really set strategic fuelings through the day. So a lunch and a dinner with minimal snacking. You're laughing. Why are you laughing at that?
I love strategic fueling. I just think that's like so like such a beautiful way to be like, eat meals, not like graze randomness, like strategic fueling. I loved it.
Yeah, it's just like if you were taking a road trip, like you would have to sort of know that at some point you just
I'm
have
going
to
to
stop
pull
for
off here at
gas.
a gas station.
That's
I
right.
love
I'm going
it.
to fuel up. And I think if we treat ourselves like athletes, and because many of us are, we work out, we take good care of our bodies, and we want to fuel ourselves the way that athletes do, which is that they're very cognizant of like making sure that they keep into their macro balance. And a lot of women, I actually see a ton of women who just really undereat. And unfortunately, when you undereat, then your metabolism slows down because your body thinks, of course, you're in starvation mode. And then as soon as you start to eat, you start to gain weight. So of course you don't want to do that. So you go back to eating very minimally. But I'm sure in your line of work, you see a lot of women who are underfueled and therefore, not feeling as good as they could be.
A couple questions here, and I know we're getting to wrapping up, but I think we could talk like on and on. So when it comes to one, this whole idea of what I think so many women have done is they have calorie restricted, they have underfueled, they have grazed, they're overeating the wrong things, not eating the right things. But let's just say, in essence, they've slowed their metabolism down, right? And they know it, and they're recognizing it's a problem, and they're listening to a lot of the things you're saying. How do you fix that? Like, what is the first step to saying, I need to get that better? Is there a way to do it that doesn't just cause you to gain back weight? How do you get your metabolism to kind of recognize that you're going to strategically fuel yourself instead of just be in like crisis mode?
I think the first step is probably to not eat after dinner. And what that will do is start to help you feel hungry in the morning. It is a really beautiful thing to wake up with a stomach fire and to actually recognize that you are hungry. And that will help you kind of get things moving in the morning. So I think the first step is really to stop eating after dinner and maybe even just tolerate a little bit of dis-ease after dinner, even if you're used to kind of fueling up at that time so that you are hungry in the morning. And then start with that a good solid breakfast that's macro balanced, has the right amount of protein, has some fat, and also has some carbohydrates to it. And making sure that you're getting most of your carbohydrates from plant rich sources like vegetables, whole grains, a little bit of fruit, and also all your pulses, your beans, lentils, etc. So if you start to macro balance appropriately and fuel yourself 3 meals a day, purposeful about it, then you start to get in this rhythm and your body starts to understand, oh wait, this lady is feeding me and this is lasting, like my hunger is satiated for the next 4 hours or so, and then she's going to refuel me again, and your body starts to understand like this is the way that you treat it, and it starts to be hungry at the right times and you start to feel more satisfied. And at the same time, if you start walking and maybe doing a little bit of resistance training and you're building some muscle and that's sopping up extra glucose and extra things that you're eating, it just becomes this feed forward cycle. And then you start feeling really positive about your body, and instead of body shaming every time you look in the mirror, you're actually like, man, my muscles are looking good, like I look good, I feel strong. And that all at once, like it just moves in this forward flow direction. But probably the first thing is really to stop eating in the later evening so that you can wake up with a good appetite in the
And
morning.
maybe be pushing that dinner a little bit earlier than some of us are having too, right? So eat it a little earlier, give yourself a little bit of that fasting interval. Imagine this like while you're asleep. So, right, versus when you're awake and doing your job.
Exactly. Just giving yourself like a good, healthy 12-hour overnight fast. So, ending your dinner by 6 p.m. so that the next morning you wake up 6 or 7 a.m., you can break your fast again is such a good way, easy way. Everybody can do that.
I think, and so many of these pieces, your pillars, they really interact together. And I think that's what's one thing that's so beautiful, right? If you are going to eat a little earlier and have your fasting interval, then you can have your nighttime routine and then you can wake up and you can have some movement that is very purpose fuel and then have your strategic fueling session. So it all seems like it does. But I think almost everybody who would listen to this would both for themselves and then also when they think about the complaints that their patients have, especially women, none of these things are being met, right? And it feels like if you make a conscious effort by moving one little piece of the puzzle, other things can start to fall in line. And I think you're making this whole body approach very accessible for somebody to say, okay, I deserve to feel better. I can do this. And this is important. So I'm going to start to make it a priority. And I love that.
Oh, thank you. That was a beautiful summary. Good job.
Tell me about some of the things that you have been working on because you have a lot of really exciting projects that exist and that are in the works. What are some things that we should know that you've been doing?
So, one of the things I'm super excited about is building a health collaborative here in Connecticut. So, I'm about 40 minutes outside of New York City. And what I've done is left my hospital job a couple of years ago and have started a private practice. And so, I work with a bunch of really amazing practitioners from health coaches to psychologists to physical therapists to women who work in aesthetic medicine. And we all work together under one roof to provide that holistic care. So, getting that all together is its own full-time job. And I'm really excited about it. And I love bringing in expert women from many different modalities under one roof and being the medical director for that adventure. Other things I'm really excited about, we're launching a culinary CME course this spring, which has been very cool. And we're doing that in conjunction with the local hospital, Stanford Hospital, which I'm really excited about. We also have some master classes online where we do expert interviews and really home in on certain detailed topics, everything from, why am I peeing my pants to hormones to sleep and all sorts of other topics in between. And that's been really fun. So I keep myself pretty busy, which is nice,
Not at all. You're not busy at all, ma'am. You need some more things on your plate now. I think it's so incredible. It's so impressive. It is just such a testament to living this way and believing it and practicing medicine in a way that really is impactful for people's lives. And I'm so thankful for all that you're sharing with our community and also all that you're creating to help people out there just essentially have a better life and a better health. what is your pinnacle pearl for women in medicine? What would you want to share with all the women in medicine who are out there living, coming from you?
When I left my well-paying job to start a private practice, I was very scared, and I had the support of so many people to help me make that jump. And I think if I could encourage anybody else who's kind of thinking like, hey, I want to do something different, I want to start out on my own, I would just say that there are so many people to catch you and help you make that transition. And if you reach out to other women, everybody is always willing to help. We just don't always know exactly how to help. And so reaching out and saying like, hey, I really need someone to help me with social media, or hey, I really need someone to help me establish this particular part of my practice. Like, someone is going to have that answer and someone wants to give it to you. So you just ask, and you ask for the resources that you need. And I'm so happy that I made that jump. It's been so good for my own sort of well-being. But it's also really fun now that I'm in these shoes to help other women see that spark in themselves and make the transition as well.
I love that. I mean, that's exactly why Pinnacle exists too, because you can learn from so many people who are not in your exact field of medicine, because that's what happens is we start to not know how other people are doing things, and we just see this one way. And watching how others are practicing the creative ways that they are reaching people, I think it's just very inspirational. So where can everybody find you so that they can learn more and listen to masterclasses and join programs and really just become a fan?
Oh, you're awesome. I love that. I'm on Instagram at DOCTOR Katie, so Dr. Katie, and I'm at drkatie.com, so drkatie.com, and my practice is wellnessinsights.com. You can also find me on LinkedIn and Facebook and that stuff, but Instagram and our website are probably the easiest ways.
Katie, thank you so much for joining us. This has been amazing. And I know even from this one conversation, you've changed some people's lives and how they approach medicine. So thank you so much.
Oh, you're so welcome. And maybe I should send you some Epsom salts.
I love it. I love it so much. Thank you.
All right. Thanks so much.
Thank you for listening to the Pinnacle Podcast, where we strive to elevate the voices of women in medicine and inspire excellence across the healthcare landscape. Until next time, keep reaching for your pinnacle.